closing the curtain for privacy. Good morning. My name is Claudia. I'm going to be your student nurse today. I'm doing good. Thank you. How are you? Awesome. Okay, so today we're going to be doing a postpartum assessment on you today, if that's okay. It is wonderful. Okay, so I'd like to verify your name and date of birth. Mrs. Mary O, 42887. Perfect. Okay, Mrs. Mario, before we go on, I want to congratulate you on your beautiful baby boy. Yes, he is beautiful. He is, no, I'm not just saying that. Of course not. He is honestly one of the cutest babies I've seen. And I've seen quite a few babies. Yes, I believe he looks like you. And don't worry, Daddy, he looks like you too. Actually, he makes a beautiful combination of both of you. Yes, those beautiful big blue eyes. Oh my gosh, they are so adorable. Yes, they identical to yours. I'm so glad. It's so heartwarming to see how enthusiastic you are about your child, and you are glowing. I get so much positivity in this room. So right now I took the time and I took advantage of the moment and I quickly assessed her emotionally, and she's doing great. That's what we want to see. She's in love with her child. She looks very happy. She's with her husband, so everything's looking great. Okay, Mrs. Mario. So before we start, I just want to ask you, did you happen to use a bathroom this morning? Did you urinate? You did? About 5 minutes ago? Perfect. It's because I'm going to be pushing down on your abdomen in a few minutes, and we don't want your bladder to be full. So it would be best if you had voided, which you did, so that is awesome. Okay, so I'm going to check your vital signs right now. Okay? So I'm going to raise your bed at the same time while I put these gloves on. I'm going to raise it up to waist level for me. Okay, awesome. Perfect height. Okay, so now I'm going to check your blood pressure. Perfect. It is 115/80. And let me check your pulse. Okay, 72. And your respiratory was at a 18, so that's perfect. Okay, I'm just gonna check your temperature, open wide. 97.8. Perfect. So everything is going perfect. Okay, Mrs. Mario. So I'm gonna start off with assessing your breasts. Okay. So I'm going to unbutton your gown. Okay. So I'm going to start by feeling each bosom. They are slightly engorged, which is great. You are producing milk. And so now we're going to assess the nipples. They aren't inverted. They are perfectly straight, and there isn't any cracking, any fissures, no redness. Perfect. And so, Mrs. Mario, do you perform self breast exams at home? You do? Awesome. How often do you do them? Once a month? Great, that's what we want. We recommend for you to do it if, on your last menstrual period. Wait 1 week after, and then we want you to lie on your side. So put your right hand rest it on your head, lay down, and then with the opposite hand you just feel around the breast for any nodules or anything that feels out of the ordinary. And you would want to pinch the nipple but for any discharge, but since you are going to be breastfeeding, milk will come out, but just be wary if any strange discharge does come out, okay? But other than that, yeah, you're doing great. And I just wanted to recommend for your bras, try not to wear any wired bras or uncomfortable bras such as Victoria's Secrets, you know, like the bombshells, the push-up bras. We recommend the breastfeeding ones. They are soft and they don't have underwire, and they have this neat little clip where when baby wants to feed, you just unhook the clip and bam, easy for him, easy for you, everyone's happy. Yes, okay, so now that we're done with the press, I'm just gonna clip this back on and cover you back up. So now we're gonna go down to the uterus, okay? I'm gonna feel on your uterus. So let me just move this blanket. Okay, so I'm gonna be pushing down on your abdomen to feel it, and it's soft, which is what we're looking for. And oh, there is your uterus. Okay, so I'm just going to put my hand on the pubic symphysis, and I'm going to feel, well, before I do that, I'm going to look at the rectus muscle. It's perfect. Now I'm going to put my hand on the pubic symphysis, and I'm going to push down here. Sorry. You're doing good. Okay, there's your uterus. It's in between hardish and soft. It's not too hard, it's not too soft. That's what we want. Rock hard one would be a little red flag. We don't want that. And a very soft mushy one would be considered boggy, and we also don't want that. But yours is perfectly fine. It's in the midline. That's what we want. Okay, so let me cover you back up. So that was that. And so now we're down to B. So your bladder, how have you been urinating often since you gave birth? Around 4 times? Awesome. That's what we want to hear. We want to hear that you urinate 4 to 6 times a day. Awesome. Okay, and now we're going to go down to okay, so the other B is okay, so now we want to actually I'm sorry. So so the other B is for bowels. I forgot how to spell there for a second. So now that I asked you about your urine, how about your bowel movements? Have you passed any stools yet? You haven't? You're a bit frightened? No worries. No worries. That is completely normal. So you know those red pills the nurse comes and gives you, those are Docusate sodium, and that's gonna help you pass the stool much easier. Also, we recommend walking around and drinking lots of fluids, okay? Okay, so now I'm just gonna listen to your bowel sounds. I'm going to clean my stethoscope. And I'm going to listen 15 seconds on each quadrant, okay? I'm going to start with the right upper quadrant. And it sounds perfect, not too crazy active and not slow, right in the middle where we want it. Okay, Mrs. Mario, so now I'm gonna do the little uncomfortable part, but you just gave birth, so I know how you feel. Everything is uncomfortable. Okay, so now I'm going to lift your blanket, okay, and I'm just gonna be checking for any discharge on your pad. Okay, so this bright red blood that we see here is perfectly normal. This is called lochia rubra. This is what we want to see, and it's, as you can see, it's not soaking wet. It's just like lightly scattered. So that is what we called scant lochia rubra, okay? And it does have a little bit of blood clot, so that's perfectly fine. So I'm just gonna throw that away and give you a nice clean pad. Okay, Mrs. Mario, you're doing wonderful. So now I'm gonna ask you to roll over to the side. I'm gonna be checking for an epidural and an episiotomy spots. Well, I'll be darned, you didn't have an epidural, so that was easy, and you didn't have an episiotomy either. It seems like you tore naturally but didn't need any stitches, so that's good. Awesome. So if you did have an episiotomy, we would want to check for the stitching and any effects to the stitching, such as redness, swelling, bruising. Is there anything leaking out of it? Any odors? But you are doing great, so we don't need to worry about that. And okay, so I can see you are very happy and in love with your child. Yes. When you go home, are you worried about anything? You're not? You have a family that supports you and everyone's happy for you? Oh, that is beautiful. That is what we want to hear. That this is perfect. Okay, Mrs. Mario, so now I'm just going to be checking on your chart a bit, okay? So right now I'm checking her chart. I'm going to check her blood type. She is Rh positive, so she will not be needing RhoGAM. And she had her rubella shot last year, so she's up to date. Everything's looking good. Okay, Mrs. Mario, that was it. That's it. Yes, that was fast, wasn't it? No, thank you. You did awesome. Thank you. Okay, so now I'm just going to lower the bed. Okay, is that fine? Yes? Okay, so, oh, you would like to feed your baby right now? Sure, I'll pass him to you. So here is your little one. You're just gonna adjust yourself? Okay. So here is your little one. And now that you got me here, is there anything else I can help you with? Don't be shy. Okay, awesome. Well, here is your call light. And don't hesitate to give me a call if you need anything, okay? I'll be right there in the nurse's station. And if not, well, I'll see you in about 30 minutes, okay? Okay, awesome. So now I just go and document all my findings and everything that I did, and that's that.